Welcome to this comprehensive clinical breakdown. Today, we're not just skimming the surface of symptoms. We're treating this like a deep dive residency lecture. The big question we're exploring is psychodynamics of anxiety. What is the mind afraid of? We're going to transition from foundational classical psychoanalytic theory straight into dynamic, highly practical clinical formulations. So let's get right into it. Here is our roadmap for today. We'll start with some basic concepts, move through the developmental hierarchy, and then break down the exact formulations for panic, phobia, and GAD before wrapping up with a comparative clinical synthesis. Okay, Section 1, Basic Concepts. Let's look at the classical model of how our minds process internal threats. It is absolutely crucial to understand that anxiety isn't just a symptom. It's actually a highly adaptive biological and psychological function. In the classical structural model, we view anxiety as a signal. Signal anxiety is basically your mind's early warning system. It's a sign that an unconscious danger is threatening to bubble up to the surface of your awareness. And the second the ego gets the signal, it immediately mobilizes its defenses to push that danger back down. So here's how this mechanism actually plays out in real time. First, a conscious fear masks a hidden, unconscious danger. The ego detects this hidden threat and triggers signal anxiety, which then builds a defense. But what happens if those defenses fail? Well, the whole system gets overwhelmed. The resulting symptom, or the rapidly escalating anxiety itself, acts as what we call a compromise formation. It's fascinating because it simultaneously hides and expresses that original, forbidden impulse. Moving on to Section 2, the developmental hierarchy. Let's map out exactly what the internal mind is so afraid of across the lifespan. This developmental hierarchy is a total game changer for understanding what the unconscious is truly terrified of at different stages of personality organization. In early infancy, the core fear is disintegration or annihilation, literally a fear of falling apart. By late infancy, this shifts to a fear of losing the object, which is essentially separation anxiety. In toddlerhood, it evolves into a fear of losing love. Then, in early childhood, we see castration or bodily injury anxiety emerge. Finally, by late childhood and adulthood, this develops into superego anxiety, or deep-seated guilt. Section 3, Panic Formulation. Let's examine what happens when there's a complete structural failure in the mind. The crucial takeaway here is that panic happens when the ego's signal function is just completely overwhelmed. We aren't talking about everyday worry here. This is a sudden, overwhelming affect. It's a massive flood of terror that hits when those defensive resources structurally fail to do their job. Developmentally, patients experiencing panic often grapple with intense separation themes, usually stemming from insecure early attachments. The intrapsychic mechanism really boils down to a massive conflict between dependency and autonomy. There is often this huge reservoir of unmentalized anger. And here's the catch. Expressing that anger feels incredibly dangerous because it threatens the very attachment figures they desperately depend on. It creates this exhausting, vicious cycle of hostile dependence. This brilliantly illustrates the biological side of things. When a trigger related to separation or anger is perceived, traumatic terror stored in implicit memory instantly lights up the amygdala. These primitive limbic circuits completely bypass the prefrontal cortex. Basically, the physiological alarm rings way before logic, reason, or regulation even has a chance to intervene. Let's look at a clinical example. We have Mr. M, who suffered from severe panic attacks whenever he planned to leave town to go hunting with his father. Dynamic exploration uncovered a hidden danger, unconscious Oedipal rivalry and intense, unmentalized aggressive wishes toward his dad. Keep in mind, he had quote-unquote accidentally shot his father on 2 previous hunting trips. So when his signal anxiety failed to contain those aggressive impulses, his system just flooded with a panic attack. The clinical implication here is huge. As therapists, we can't just treat the somatic symptoms. We have to map out these specific triggers. Our job is to help the patient consciously mentalize their hidden anger and dependency conflicts rather than just medicating the physical panic away. All right, Section 4, Phobia Formulation. Let's see how the mind actively externalizes danger. Unlike panic, which is a total system overload, a phobia is actually a highly structured, organized defense mechanism. The mind takes an unacceptable internal terror that it feels it can't control and physically projects it onto something in the outside world that can be easily avoided. It's a very clever, albeit restrictive, workaround. The intrapsychic mechanism here relies on a brilliant sequence of adaptation. The fear of a forbidden wish and the retaliatory punishment for it is handled through displacement. the fear is shifted onto a seemingly trivial external derivative. This is the exact externalization of an internal danger, basically tossing a superego threat out into the environment. And finally, the patient engages in rigid avoidance of that new external symbol to keep the true conflict safely repressed. Take Mr. N, for example. He suffered from social phobia, specifically an intense, paralyzing fear of saying his own name during introductions. Clinical evaluation revealed this was actually an externalization of a childhood Oedipal fear. He displaced his original internal danger onto the simple act of saying his name, which unconsciously symbolized the assertive act of replacing his father. Clinically speaking, this means we can't just treat the avoidance behavior with straightforward exposure therapy. We have to trace that phobic symbol all the way back to the original internal conflict and uncover the internalized critical audience the patient is projecting onto the world. Section 5. Generalized Anxiety Disorder Formulation. Let's talk about cognitive avoidance. In GAD, chronic worry isn't just a byproduct. It is absolutely crucial to view this chronic worry as an active cognitive defensive activity. It's literally a strategy the mind uses to distract itself from much deeper, far more disturbing underlying concerns. Developmentally, this also roots back to early insecure or conflicted attachments. The primary mechanism at play is the avoidance of deeper affect. Patients use superficial, constant worries to avoid confronting what we call core conflictual relationship themes. Imagine a patient obsessively worrying about an office deadline. Intrapsychically, they're doing this solely so their mind doesn't have to face a terrifying fear of abandonment or perhaps intense repressed anger toward their spouse at home. So what's the clinical implication? We really have to look past this superficial, somatic complaints. We need to use the anxiety as a window, connecting these seemingly disparate situations of worry to uncover the recurrent, core relational conflicts they're desperately trying to avoid. Finally, Section 6, Clinical Synthesis. Let's do a differential comparison of everything we've just covered. This table brilliantly illustrates the dynamic formulations for all three. Panic represents a total structural failure of defenses against separation and unmentalized anger. Phobia, on the other hand, actively uses displacement and the externalization of internal danger to dodge superego guilt. And GAD, it uses the cognitive avoidance of chronic worry to mask core conflictual relationship themes. As you can see, the underlying engine driving the fear is fundamentally different for each disorder. As we wrap up this explainer, I want to leave you with this final thought. If we view anxiety solely as a biological illness to be eradicated with medication, what vital signals from the unconscious are we silencing? Mastering the psychodynamics of anxiety allows us to actually hear the mind's distress signals, rather than just muting them. It forces us to step back and ask, what is the mind truly afraid of? Thank you so much for joining me in this deep dive.